Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we're going to dive right into the human brain to solve a fascinating medical mystery. Just picture this for a second. Your thoughts are crystal clear. You know exactly what you want to say, but the words, they're just locked away. You can't get them out. What on earth could be happening?
So this is it. These are the only words a 53-year-old man can get out. Can you even imagine the terror, the sheer frustration? He's desperately trying to say, I felt weak this morning, but this is all that comes out. This right here, this is our biggest clue. It's the heart of the puzzle we need to solve.
Okay, so picture the scene. This man is in the ER. You can walk up to him, you can talk to him, give him instructions, and he gets it. He understands everything perfectly. But the moment he tries to talk back, it's like the wire between his brain and his mouth has been cut. His thoughts are completely trapped inside. All right, so to figure this out, we've got to put on our detective hats. The key is to look really closely at what he can still do versus what he can't. If we do that, we can actually zero in on the exact spot in his brain where the problem is. And just look at this contrast. It's pretty stark. Check marks on one side, he gets language, he can follow commands, and that frustration, that's a huge clue. It tells us he knows something is wrong. But then look at the other side. Speech is broken, effortful. And then there's that other really important piece of the puzzle. He's got weakness on the right side of his body. Okay, so when you put all these clues together, they all start pointing to one very specific thing. We're looking for a problem that messes with speech production and motor control on just one side of the body, while leaving comprehension completely alone. So, what in the world could do that?
And here it is. This is our answer. What we're seeing is a textbook case of Broca's aphasia. You see, it's not a thinking problem. It's a production problem. It's a motor issue. The words are all there in his head, but the part of the brain that plans out how to move the mouth and tongue to make those words, that's what's broken.
So we've got the what, Broca's aphasia. Now we need the where. Where exactly in the brain is this all going down? Let's pull up a map of the brain and see if we can connect the dots. You see that spot right there, the highlighted part? That's it. That's Broca's area. It sits in a part of the frontal lobe called the inferior frontal gyrus. You can think of it like the brain's speech production factory. It's the control room that creates the blueprint for moving your lips, your tongue, all the muscles you need to actually form words.
But wait, remember that other clue? The weakness on his right side? That is absolutely not a coincidence. Turns out it's directly linked to where Broca's area is located, and it's going to help us narrow down the culprit even more.
Okay, look at the brain map again. See how Broca's area has a next-door neighbor. That's the primary motor cortex. That's the part of the brain in charge of all your voluntary movements. So what's happened here is the damage isn't just in the speech center. It's like a fire that has spread next door, hitting the part of the motor cortex that controls his right arm and face. And this brings us to a really cool, fundamental rule about the brain. It's basically cross-wired. The left half of your brain controls the right side of your body, and vice versa. Since Broca's area is in the left hemisphere, any damage there is going to show up as weakness on the right side of the body. It makes perfect sense.
So the big question is, what could possibly damage both of these neighboring brain areas at the exact same time? Well, the answer isn't in the brain tissue itself, it's in the plumbing. It turns out there's one single blood vessel, the left middle cerebral artery, or MCA for short, that supplies all the fuel and oxygen to this whole side of the brain. If you get a clog in that pipe, a stroke, you starve both Broca's area and the motor cortex at the same time. And boom, you get all the symptoms we're seeing.
Okay, so Broca's is a big one, but it's not the only type of aphasia out there. And to really get what makes it so distinct, it really helps to compare it to some of the others. This will make things super clear. All right, just take a look at this chart. It lays it all out. For Broca's, what we've been talking about, speech is nonfluent, totally broken up. But comprehension? That's fine. And the patient knows it, they're frustrated. Now flip that for Wernicke's aphasia. They can talk up a storm, totally fluent, but they can't understand you, and what they're saying is nonsense. And the wild part, they have no idea anything's wrong. It's just a completely different world.
Yeah, check this out. On the left, someone with Wernicke's might say something like, yes, the sky, television runs happy paper. The words flow, but it's pure word salad. It doesn't mean anything. Now compare that to our patient with Broca's aphasia. He struggles to say, I, weak, morning. It's effortful, sure, but it's packed with meaning. He's trying to communicate something real. The difference is just night and day.
All right, let's tie this all together because there's a really powerful pattern emerging here. It's almost like a master key for understanding strokes. If you know which artery in the brain gets hit, you can pretty much predict exactly what symptoms you're going to see. It's an incredibly useful tool.
So look at the MCA again, the middle cerebral artery. It feeds the whole side of the brain, right where the language centers and the face and arm control centers live. And that's why an MCA stroke gives you that classic combination of symptoms we saw, aphasia plus face and arm weakness. Now compare that to the others. An ACA stroke hits the middle, so you get leg weakness. A PCA stroke hits the back where the vision centers are, so you get vision loss. You see, the map of the blood vessels is literally a map of what can go wrong.
So, what's the one thing you should burn into your memory from all this? It's this pattern. If you ever see someone who has slow, effortful speech, but they can understand you perfectly, and you can see the frustration on their face, your brain should just scream two things: Broca's aphasia, and the cause, a left MCA stroke. It's a classic pattern, and it's a super important one to know.
And so that brings us right to the end, to our final, complete diagnosis. We can say with confidence that our patient has Broca's aphasia. It was caused by a stroke in his left middle cerebral artery, which damaged Broca's area and spilled over into the motor cortex right next door, which explains the weakness on his right side. All the pieces fit. Mystery solved.
It's pretty wild when you stop and think about it, isn't it? Our ability to talk, to connect, to share our ideas and feelings, basically a huge part of what makes us us, can all hang on the health of one tiny little blood vessel in our brain. It just goes to show you how incredibly complex and honestly, how fragile this whole thing of being human really is.